There have been plans all along in the sense that hospitals, schools, health departments, and communities through regional planning networks do preparedness activities. And those plans vary from, at this stage you get all your key stakeholders together, but it might not say exactly who those stakeholders are, because each crisis involves a different answer to that question. So when we talk about that planning that's already existed, that means that you have identified all the people you work with and sort of the processes you go through. But those answers specific to this unique public health crisis, this unprecedented crisis, those never existed. And we didn't have a coronavirus COVID-19 plan. And so what we really asked for was share with us all your thoughts and what you're thinking. It wasn't just something they sent to us, although some had various levels of like, here's who we have on our team. But we actually have a team of people who have sat down and gone through a really in-depth interview of those folks, because the answers are a little different by community. And they're compiling all that and sort of taking that in, and they're collating that up into this larger systems approach. And that work will not stop. I mean, there won't be a point, maybe afterwards when it's all done, there'll be a published, like, how it worked. But it will never stop, because quite honestly, we're burning daylight here, as the governor always says. We're building this every second of every day. And some of those plans include things like, this hospital is going to now become the designated real high-intensity hospital, and they might actually refer more to their low-intensity routine things to the neighboring hospital. But that varies in different parts of the state. And it has to do with communications. Like, we have almost like an air traffic control process in place that already exists in healthcare when we have level 1 ICUs. And when you have a trauma, which hospital does it go to next? Where does MedFlight fly the patient to? So we're taking those we're opening more gates at the airport, we're doing our air traffic control, but we are actually building a more specific air traffic control tower back at the EOC that watches this alongside the regions. And then they're opening up more gates at the airport for more traffic. And that is the level of planning we're doing. So we're building out the exact way we're going to communicate. And then if we see in one area that all of a sudden, because we know this will surge, not all at once, it'll surge in different communities at different times. Oh, from the ground, with General Harris's folks, we're short of this PPE, and we've just received a shipment. Our job will be to get that out to the right place at the right time. So it's the logistics of that. So that's the process that's going on in a nutshell. It's being invented specifically for this situation. And I want to add, just real quickly, those plans that go on like that, they are across state borders. So Kentucky has already been talking to Cincinnati as part of routine business, so it's really helpful because we already have those relationships. Thank you.